Hi, my name is Sara Mann, and I'm an MD MPH student working with Deanna, Kepka, and her team at the Huntsman Cancer Institute. I'm excited to present some of our findings from a recent survey about the COVID-19 pandemic and vaccine hesitancy among young adults in the Mountain West. Our team was interested in understanding vaccine hesitancy in the context of the COVID-19 pandemic. From October 2020 to February 2021, we distributed an online survey to young adults in the Mountain West. The purpose of the survey was to gain insight from young adults about the COVID-19 pandemic and vaccine to help identify areas for intervention. The survey asked participants to report whether they would intend to vaccinate against COVID-19 if a vaccine became available. Based on their response, participants were also asked about reasons to vaccinate and reasons to not vaccinate. Chi-squared and Fisher-exact tests were performed to determine if a difference exists for vaccine intent between communities based on zip code, self-reported race, or self-reported ethnicity. The rural-urban continuum codes were used to determine rurality. These codes distinguish metropolitan counties by the population size and non-metropolitan counties by degree of urbanization and adjacency to the metro area. Because there was some overlap between zip code and county boundaries, some zip codes were included in both urban and rural counties and were thus categorized as either urban or rural. There were 1,622 participants with a median age of 22 years. 1,231 respondents were categorized as urban, 226 were categorized as rural, and 165 were categorized as either urban or rural. The majority of respondents were female, not Hispanic or Latino, and white or Caucasian. The majority of respondents were from Utah, and the majority of rural respondents were from Wyoming, Colorado, Idaho, Montana, New Mexico, and Alaska. Only 65% of rural respondents reported intent to receive the COVID-19 vaccine. This was a considerably smaller proportion compared to urban respondents. The difference in the proportion of respondents intending to receive the COVID-19 vaccine among these groups was statistically significant. The response distributions for Hispanic or Latino compared to not Hispanic or Latino respondents were statistically different with regard to COVID-19 vaccine intent. Notably, a larger proportion of Hispanic or Latino respondents reported they would not intend to receive the COVID-19 vaccine. Vaccine intent also differs based on self-reported race. About 85% of Asian or Asian American respondents intend to receive the COVID-19 vaccine, whereas only 66% of American Indian or Alaska Native respondents intend to receive the vaccine. However, while the differences were statistically significant, there were subgroups which had fewer than 5 observations, and the estimates can be considered as unstable. That is, adding a handful more observations would likely change these estimates. The most common reasons to not receive the COVID-19 vaccine include concerns about side effects and perceived seriousness of the pandemic. Many respondents chose to write in other responses to explain why they chose to not receive the COVID-19 vaccine. The most common reasons selected to receive the COVID-19 vaccine include a doctor's recommendation and a desire for life to go back to normal. Our results suggest rural communities and racial minorities, specifically Hispanic or Latino populations, should be a priority recipient of interventions to decrease vaccine hesitancy among young adults. In Utah, vaccine eligibility now includes anyone over the age of 16. And with the addition of more information on vaccine safety, there is substantial room for improvement within these populations. Interventions might include culturally tailored messages or targeted media campaigns about vaccine safety, efficacy, and low risk of side effects, especially from healthcare providers. I would like to acknowledge and thank Deanna, Kepka, and her team for their help and involvement with this project. I would also like to extend my appreciation to the Surge Conference coordinators for the opportunity to present these findings. Thank you.